Good morning. Good morning from Hong Kong. It's my pleasure to welcome all of you to episode 13 of COVID-19 Update. I am Alice Mong, Executive Director of Asia Society Hong Kong Center, and I'm delighted that today we have a collaboration with our Australian colleague with Asia Society Australia to present episode 13 of this update. And we're very honored to welcome Professor Peter Doherty, 1996 Nobel Laureate in Medicine, to speak with us from Melbourne. And in a few minutes, I'm going to turn it over to my colleague, Philip Ivanov, in Melbourne to get the program formally started. But before we start, I just want to give everyone a brief update. I think over the weekend, we've crossed over to the 3.5 million mark in terms of the people infected with coronavirus, COVID-19. But one of the numbers I also want to mention is 1.1 million have recovered from this virus. In Australia, I understand the case is over 6,800, and there's been some new cases reported this weekend. In Hong Kong, we're still at 1,040. We're very happy that there has been no local transmission of the virus in the past 2 weeks. Hong Kong government is back to work today, and we expect more social distancing measures to be lifted this week. So we're really happy with some of the news here, and also very saddened by some of the news around the world. But again, we're all in this together to fight this virus, and that's one of the reasons we started this COVID-19 update, is to give people the information directly from the experts, from the medical expert, from the researchers. So again, very delighted to have Professor Doherty here. In recognizing this webcast is a joint Asia Society Hong Kong and Asia Society Australia program, I'd like to take this opportunity to acknowledge that many participants in today's events are dialing in from locations that have traditional owners and custodians. We would like to acknowledge those owners and pay our respect to their elders, past, present, and emerging. So right now, it's my great pleasure to introduce the Chief Executive Officer of Asia Society Australia, Philip Ivanov, to get our program formally started. Philip, over to you.
Thank you, Alice, for your introduction, and good morning and good evening. Welcome to Asia Society. Hope you're all doing well. Welcome to our public conversation with one of the world's leading infection and immunity experts and Nobel Prize winner, Professor Peter Doherty. Peter needs no introduction, of course, but I'll do it anyway. Peter is the patron of the Peter Doherty Institute for Infection and Immunity here in Melbourne. He shared 1996 Nobel Prize in Medicine for discovering the nature of the cellular immune defense. Based at the University of Melbourne, he continues to be involved in research focused on understanding and preventing the severe consequences of influenza virus infection. In addition, he writes on childhood vaccination, global hunger, environmental degradation, and climate change. He helped start the now global academic blog, The Conversation. He is very prolific on social media and has published 6 books on science and scientific life. Welcome, Peter. I'll start with science. How far do you think we are from the COVID vaccine?
Well, the earliest dates that have been put out there for possibly having a COVID vaccine out there in community is September this year. That's for the Oxford Jenner Institute vaccine. It's using a fairly standard technology. It's a chimpanzee adenovirus vector, we call it, which means you've taken a well-developed system from a virus and plopped in a bit of the SARS-CoV-2 genome to make a vaccine. Now, that's been through laboratory animal testing in, I think, ferrets. That was done in Australia. It then went through testing in some monkeys, and it's already gone into a few human arms in the United Kingdom. And I believe there's an order in for 60 million doses of vaccine from an Indian company. Now, what's going to happen now is the only way you can test a vaccine in humans in the face of a virus outbreak is actually to give it to people and then let them be exposed. We can't challenge them. This is a potentially lethal virus. So that's what's going to happen. They will gradually ramp up the numbers of people who are vaccinated and exposed in an environment like the UK, where there is a lot of action, a lot of activity, and a lot of virus circulating, and see whether it's protective and safe. And they will get that answer. I think that won't take terribly long to get that answer, maybe a few months. And then they will know whether it's likely to be safe to give it to large numbers of essentially normal human beings, because most younger people don't get a severe disease from this thing. But I would not be surprised to see that rolling out in substantial numbers of people from September, if things go well.
Thank you. And in your recent podcast interview with the New Daily, you mentioned that COVID-19 may be contained in the same way that HIV is controlled via a daily antiviral drug. Could you tell us a little bit more about this?
Yes, there are two concerns about the vaccine. There have been some concerns about safety from some earlier experimental work that was done in monkeys that indicated that some, but by no means all, experimental vaccines caused some problems. Now, that never went on into extensive human trials because SARS disappeared, and the MERS vaccine, I think, hasn't gone forward because even though it's active, there are too few people infected with it. So there's another issue too with vaccines, and that is how well will they work in the elderly, because older people simply don't make great immune responses to things they've never seen before. And we encounter that particularly with influenza. The influenza vaccine that's given in Australia to older people is a vaccine that has a lot more product in it to develop a much better immune response. So the main group at risk, of course, of COVID-19 is the elderly. So if the vaccine doesn't work well in them, we're going to have to work out some strategy that they can be taken out of lockdown. Now, the example of this is from AIDS. We've never had an AIDS vaccine, and it's a good possibility we'll never have one. But we can keep AIDS under control with specific designer drugs. These are drugs that are totally specific for AIDS, and they block different aspects of the virus replication strategy. And so if people are given these drugs, and I think they take a cocktail of 3 or 4, then they don't get symptoms and they live normal lives, but they're still infected. Now, and further development of that strategy has to be to take 2 of those drugs and combine them together into a product called Truvada. And people who behave in a way that's likely to put themselves at risk can take Truvada, I think, every day, and they won't get AIDS, because if the virus does get in, the drugs will stop it straight off. So that would be a possibility for older people or people who have no or poorly functioning immune systems. And of course, there are those in that situation among younger people and even children. It's called HIV PrEP. Okay.
Now, you also mentioned quite a few things about testing. Testing is a powerful tool, as we all know, in the response to this pandemic. You were quoted saying that testing sewage is an efficient and effective way of detecting how many people are indeed infected by COVID-19. Could you elaborate on how this might work, and if any cities have plans to put this approach into practice?
There's already some of it happening in Australia, and I'm not sure how extensive it is yet, but this is a very standard procedure. It's used to test whether poliovirus is active in a community, and it's used also to test whether norovirus, the one that traditionally causes short diarrhea outbreaks on cruise ships. People get very sick and they feel like they're dying, but in 3 or 4 days they're fine. So it's always been a problem. So what is done is that the standard PCR test, the test that detects viral genome, not infectious virus. And this is the test that's being used for screening human beings, and it's a very sensitive test. So you can take sewage And at least for poliovirus or norovirus, you can, by testing wastewater, detect that there's infection up to a level of about 1 in 10,000 in a community. So it's a very good background screening way where if you think you've hammered the virus into the ground, which may be possible in a couple of the Australian states, if you think that's the case, you can test sewage and see whether it's out there somewhere. And so it's a good broad screening test.
Thank you. A reminder to our audience that this is an interactive program. Ask your questions on Slido. You would receive the password in the reminder email, and I'll pass these questions to Peter. Let us move on to public health response to this pandemic. What are some of the key learnings from how the virus was handled around the world? Which countries are doing well? What's your assessment on how Australia and Hong Kong have handled the public health response so far? And what are some of the bad examples of public health responses?
Well, Hong Kong, of course, has been well ahead of us in this, and I believe you've handled it pretty well. And my understanding is things are reasonably okay in Hong Kong, and you're looking at lifting some of your restrictions. So in the discussion we had before we started, I understand the schools may be out till the end of the Northern academic year, which I guess would be August before they would start. So I think you guys have done really well. China, of course, did really well with some fairly aggressive policy, which probably wouldn't go over too well in Australia. But we locked it down early. I was very impressed with the way our Prime Minister and the premiers of the different states, we have a federal system, doesn't always work together all that well, but they worked very well together on this. And we locked down as well. We didn't go to the level New Zealand went with level 4 restrictions. We've always been able to walk outside while maintaining social distancing and go to the coffee shop and pick up a takeout coffee, so long as there's only one person inside at a time and that sort of thing. So it looks pretty good here at the moment, but we'll be starting to lift restrictions soon. You can't keep these countries locked down indefinitely, both because of economic and social issues. But what it did, and locking it down, it allowed us to buy time to get much more testing in place so we can test much more if we do get a flare up, and much better hospital resources in place, ventilation machines, more beds, more trained personnel. So it's given us a great opportunity to get through some of this. In fairness, though, I must say, I don't think we ever had the level of background infection that was prevalent in the United States or Europe. Basically, we were onto it fast, and we we put all sorts of limits on incoming travel and so forth very, very quickly. We don't get the level, we get a lot of tourists, but not the level of tourism you'd see in the US or in Europe. And I think it was really operating in the United States for maybe even a couple of months before they got on top of it. And they dropped the ball very badly. And of course, they're having a very bad time, as we can see, with many states now in one or other level of lockdown. Korea did very well with it. They didn't lock down totally. They did a lot of testing. And as we know, Korea is a pretty disciplined country too. I mean, socially, Koreans accept a degree of direction and so forth that, again, some Western countries don't. Britain did badly with it. Italy was a colossal tragedy. Spain has damped it right down with level 4 restrictions, as has Italy. So various countries have dealt with it in various ways. I think the United States is particularly concerning to watch, and because some of the states are going to lift restrictions, they say, well, they've still got very active infection going on. And I can't see that going well. So the US will be like a series of experiments. Of course, there is an argument out there that says, lock up your old people as much as you can and let it rip, and we'll get everyone through this quickly. That was tried in Britain, but they backed off it. But that is, to some extent, what's been advocated in some regions of the United States. And you've seen these demonstrations and so forth. Problem with the US, of course, is they have very poor social services, and at the lower income levels, pretty bad access to medical facilities.
Thank you. You probably get asked this question a lot. Were you surprised at all just how quickly and widely the COVID-19 has spread around the world?
I shouldn't have been, should I? Because I've been writing about influenza for years, and I've been very much in touch with the outstanding influenza group at the University of Hong Kong, wonderful group. And I shouldn't have been surprised, but I was. I was not only surprised by the fact it was happening, you know, I've been writing about this, talking about it, but hey, this is happening to me. That's not fair. So, so here we are. We're dealing with it, and it's initially, and the perception, the line that's been held to is that it's about as infectious as a seasonal influenza. That is a reproductive number of about 2.5. One person will infect 2.5 other people. These are kind of averaging type calculations. But some people think it might be as high as 5. And that's very concerning. It does seem to be very infectious. But fortunately, most people don't get severe infections. And where it differentiated, say, from the horrible 1918-19 flu pandemic, is it's not killing fit young people. So it's not as bad as the 1919 flu pandemic, 1918. And of course, we're in much better shape medically and in every other way to deal with it. And we may well have, I think, a reasonable vaccine and maybe some reasonable drugs by the end of the year. And with flu, in 1918, they didn't even isolate the virus until 1933.
Thanks, Peter. In the Group of 8 Universities report released last week called Road to Recovery, a group of Australian scientists suggests 2 strategies for Australia. One is eliminate the illness, and 2, suppress the illness to a low level and manage it. What's your preferred strategy, and do these 2 options work for all countries?
Well, as with everything, these strategies are big experiments, and we're going to learn a lot from COVID-19. It's not the worst possible virus that could hit us, and I think if something worse were to come along later, we'll be in much better shape for having had this experience, horrible though it is at the present. Clearly, Australia has not gone for an eradication strategy. We were very surprised that we got the numbers down so low, and that really shows, I think, that people have been behaving responsibility, but also it shows that we didn't have the high levels of background infection. So I think we're going for a suppression strategy, and that we will see more cases, and I would be very surprised if we don't see some ramp up when we start to lift controls, but maybe we'll just be super lucky. You know, Australia has been called the lucky country. We often get away with things. I mean, you know, we're kind of descended from criminals and bushrangers. So sometimes we just get lucky.
Great. What's your view on implementing an immunity passport system and coronavirus tracing app in Australia and elsewhere? Will it be sufficient to track and keep a lead on infections?
The tracing app is a tool. I think we need many tools, and we do need responsible behaviour. I think it may be useful. I mean, I'd certainly like to know if I've been exposed. I've still got to work out how to get it working properly on my iPhone, but that's a different type of challenge to do with aging. But I think there is a bit of a problem with some of the platform as yet. But it's not important now. It's important when we lift restrictions that we have this. I'd certainly like to know if I have been exposed, because I would in turn expose my wife. And there are plenty of situations where 2 older people, one has become infected and died, and the other has become infected and died. So we're trying to avoid that scenario. I've got to finish a book apart from anything else. And so, yes, I think the app is one way of getting out there with this. But what's going to be, I think, much more important is as soon as we identify a case, to do very, very aggressive contact tracing and community testing, and keep up a level of community testing. There are discussions of testing at the level of, I think in Victoria, 10,000 tests a day, for instance. And we've tested a lot, and that's a lot more than we've been doing.
Now, let me turn to politics and international relations around COVID-19. On April 15th, the Trump administration cut its contribution to WHO funding, with Trump alleging that WHO failed in its basic duty and must be held accountable. Is this a view you share?
Well, along with about 50% of the American population, I think about 80% of the Australian population, I am not a fan of President Trump. And I don't trust either his veracity or his integrity. I think he's a different type of president, should we say. I think President Trump's manipulations are all to do with getting re-elected in November. I don't take them seriously. The WHO stumbled on a couple of things, I think. I think they should have declared a pandemic earlier than they did, though they were putting out good information, including to the United States administration. There was no way that the US was not being well informed about what was happening and what the risks were. They simply chose to ignore it at the presidential level. And President Trump, of course, has to take responsibility for that, but he's not notorious for ever taking responsibility for anything. And they also, I think, when they said live markets are just great, that really stirred people up because we think live markets are not great. And so that's been an issue. But there's an enormous amount of work that goes on that's WHO sponsored and is behind the scenes. That's enormously important. It's done by professionals, including professionals in our country. And it's just so important for validating tests and strategies and all the rest of it. So defunding WHO in the face of a pandemic is probably the most irresponsible thing that one could possibly imagine doing.
Mm. Do you support calls by a number of world leaders, but by our own Prime Minister and President Trump as well, for an independent inquiry into the origins of the coronavirus?
I think this started as part of the Trump administration's distraction strategy. Look over there. Don't look at me because I'm doing such a crap job. But basically, let's look at that. So, okay, so we think, and this was from Ben Cowling at University of Hong Kong that we first heard this. He was in Australia. The initial idea was it did start in a wet market in Wuhan, that it came to maybe a pangolin via bats and then spread to humans. And the focus of infection was evidently said to be the seafood market, which is where the live animal market was. Now, we don't, there's no proof of, absolute proof of that. We are pretty certain, I think everyone's pretty certain, it's come from bats, that it's a bat virus, just as the MERS virus was and the original SARS-1 was. Okay, so we know that. Now, then the Chinese and some Chinese and European virologists have suggested, well, we're not convinced that it came out of the wet market. We think it may have come through another species. It might have got into wildlife, for instance, and got from wildlife into humans. Maybe not in Wuhan, maybe somewhere else. Someone brought it into Wuhan. So I think what needs to be done there, and the Europeans, Germans particularly, are talking about this, is to do a lot more testing in wildlife in China, in that region, to see the truth of it. Okay, the other possibility, other possibilities are that this was some sort of genetically engineered virus that was released deliberately. Well, we know the Chinese wouldn't have done that, or if they would have done it, they wouldn't have done it in Wuhan. So there are suggestions that some American scientists did that. That is absolutely ridiculous. But it's just part of the general stupidity around this issue. The other possibility is, of course, that it is a virus that was got out of bats or out of wildlife. It was being worked on in the lab, and somehow or other it escaped. Now, if we look at the virus, the virologist looking at the virus can say, I think with a reasonable degree of certainty, that this was not an engineered virus. Nobody had been trying to manipulate it. It just doesn't look like that, and it doesn't resemble any of the earlier ones. So the other possibility is straight from wildlife, or it did get escaped from the lab. Now, okay, so it's possible, and we don't know, and the only people who can really tell us here, of course, are the Chinese. You can be sure, though, if they thought it came out of the lab, they will have corrected that problem. If it was an engineering problem, it will have been fixed. If it's a personnel problem, it's been fixed. Now, let's look at the other thing here. How does it help us deal with COVID-19, which is currently killing large numbers of people, to promote a divisive agenda which divides the international community? And the answer is, it does not help us in any way whatsoever. This inquiry, by all means, have this inquiry, but have it later, have it done by scientists quietly, systematically, and work it through. For now, we need to deal with COVID-19. There is no point in antagonizing China. There is no point in promoting divisiveness, unless, of course, it's to get President Trump re-elected, which is a situation that all of us hope will not occur.
Mm. And are you generally pleased with the way researchers and institutions worldwide are collaborating globally on the COVID-related research at the moment? And can you say
Absolutely.
the same?
We're getting fantastic collaboration across the planet. Everyone just wants to solve this problem. And I think that's as true of commercial operations as government-funded research or anything else, or public health. We just want to get through this and to get the world back to economic and social health. The longer it goes on, the more damage is done in all sorts of ways. So the sooner we get through it, the better. There is an issue, though. If, for instance, with vaccines, if we went for a protein vaccine, there's not an unlimited capacity to produce this stuff. So we need everyone on the planet getting together. And Australia, it worried me that we might be at the end of supply chains, but I did find that our big company, CSL, does have a substantial protein production facility in Australia. So I think that's the issue. I don't see any point in antagonizing any country that could potentially produce product, whether it's drug or vaccine or anything else. And as we know, China has enormous productive capacity. Personally, my view of China in this is that they did what had to be done early. They made the sequence of the virus available in January. That allowed us to develop a diagnostic test, and it allowed the people who are going to try to make a vaccine to get on with that issue. So that's what we needed to defeat COVID-19. That's what we still need. And promoting divisiveness and bad feeling and playing those stupid games that human beings are so fond of is simply a moronic exercise.
Thank you. How important do you think is philanthropy in helping to find a cure or vaccine for the COVID-19?
It's massively important because it allows you flexibility, or it does allow you to develop targeted programs. And we've had a lot of philanthropy from great sources, and including, of course, Jack Ma, who's given money to the Institute for very targeted programs designed with the purely practical business of dealing with this. Yeah, philanthropy is great, and it's been terrific to see the people who've come to that party and have really made substantial donations, both from their own resources and from foundations and so forth. I think all of us, and I'm not just talking about our institute, are immensely grateful for that help. And we're doing the best we can with those resources. But we should not forget that, and I made this point in my pandemics book that I wrote some years ago, that what's enormously important is to keep public health funded in the public sector. And that is where we've seen some cutbacks over the years. I think, again, this is extremely counterproductive and doesn't help anyone.
You mentioned this conflict that we're observing between the United States and China at the moment. Can you say the same thing about the collaboration between middle powers like Australia or smaller powers? Have they stepped up? Have they been collaborating better than perhaps the United States and China were?
I can't really speak to that in any detail, but I think everyone's been collaborating. It doesn't matter whether you're in a big country or a small country. I'd be very surprised if a lot of American scientists are not collaborating with Chinese scientists. I mean, science is an international culture. Even with Nazi Germany, people were collaborating on things that weren't of strategic defense type interests for quite a while. It's really the way we operate. We're just interested in the truth behind things. We're not interested in the politics of it, unless it gets into that defence area. And that, of course, you have to be very sensitive about your own national government and so forth, and safety issues. And so that's always really well controlled, of course, and we're conscious of it.
Mm-hmm. A slightly futuristic question. How will COVID-19 shape the future world we live in? And particularly, I want to put to you a proposition that two trends may emerge, not simultaneously perhaps, in the post-COVID world. Number one is countries may realize that how bad our collective response has been and start cooperating better. And I'm talking about governments, not scientists, which may lead to sort of revival of the multilateralism, the strengthening of international institutions. And the other trend is countries will look more inward and focus on nationalism and self-sufficiency, diminishing the role and influence of international institutions and international cooperation. What's your prediction?
Well, the second one, which is a depressing scenario, is the one that particularly the United States has been going down under Trump. And I think it's disastrous, and it's been disastrous for them. And if it goes on, it'll be disastrous for all of us, even more so. I hope the first will re-emerge. I think this is one world. We have to work together. If we work together, we'll defeat COVID-19 much more quickly. Providing divisiveness will get us nowhere. And I hope we will learn that lesson, and that we will go back more to internationalism. We've been living with a world where we have globalization of trade, but we have less and less globalization of governance. And that means that countries haven't been gathering substantial tax revenues they should have received, that some business people have been behaving essentially like robber barons, and that's been a disaster. So we need to work to a world where there's greater equity, greater sharing, and greater international collaboration. If we don't do that, we're in enormous trouble, because the big threat out there after COVID-19 is over, and it's a much more long-term threat, which is why it's harder to tackle. It's clearly climate change. And of course, if you're in Hong Kong, you wouldn't want to watch the water levels rising substantially and quickly, just as we won't want to watch that happen in Australia. But it will happen unless we deflect this whole thing.
And that leads to my next question. You've written quite a lot about climate change and environmental degradation. What is the link between infectious diseases and the changing of climate?
It doesn't particularly apply to COVID-19, I think. I think climate change is not a major issue with COVID-19. It applies to diseases like malaria, where as the planet warms, they will move further up into the hills, and say Kenya or in Hawaii with avian malaria. It applies to flooding, and with climate change, we're already seeing these major downpours and massive floods, overwhelming of sewage systems, and risk of infection and all the rest of it. I think a lot of, and also mosquito-borne diseases moving further away from the equator. I think personally that the infection issues to do with climate change are not the major issues we have to deal with. I think that scientifically we can deal with them. We can develop vaccines, we can develop strategies. I don't see that as the major problem. The major problem, I think, is going to be on livability of the planet, quite frankly, and that's where we really need to focus. I mean, when, for instance, you have the Swiss Electricity Authority saying, hey, where are we going to get our water for hydro because all the glaciers are melting? Or when you have, say, Bolivia running out of water because there's no glacier melt. This is the issues we're going to have to face. They're much, much bigger issues than infection.
Thank you. On WHO, there seems to be a consensus that it can improve its governance, it can improve the way it operates. What are some of the practical recommendations that you would make on improving WHO's operations as well as mandate?
That's not an issue that I'm really very informed of. I have had some dealings with international agencies, Not really much without WHO at all. But I mean, I think if you've dealt with international agencies, you realize the problems. The problem is they are international, that appointments at high levels particularly are not necessarily by merit. Sometimes you get outstanding people, sometimes you get complete duds. At a lower level, it can run very well at all, indeed, providing that it's not interfered with. For instance, the World Health Organization Influenza Collaborating Centre Network that monitors influenza and recommends the different vaccines and so forth, that operates out of Geneva, does extremely well. So I think that there are always issues with these international agencies. I'd like to see some of them fixed, but don't ask me how you fix them. I mean, if you think WHO is bad, I mean, some of the other ones are even more clunky at the top level. I think once you get beyond that, though, there's often a lot of real professionalism and real contribution. And sometimes you do get outstanding people in charge of WHO.
Thank you. Just some questions from our audience. One is, what do you think is the true fatality rate for COVID-19? And do we know it?
No, we don't. We don't because we don't know the true background infection rate. And in many countries, we may not actually know how many people are dying of it. You know, often with these things, what you do is you look back over the year and you look at the excess mortality rate. Now, so we probably have reasonably good data from Britain and Italy and those countries, for instance. Certainly from our country, where we've had very few cases and less than 100 deaths. So the question is, what is your mortality rate related to? So if you relate it just to clinical cases, it's quite high. I mean, it can be 5%, and certainly much, much higher in the elderly, 14%, even above that, if you're above 70 or 80, above 80, I think. On the other hand, we don't really know the background infection rate in the community. We know there can be quite a bit of infection that's subclinical. What we don't know about them is how much they transmit. Because if you're not coughing and spluttering, are you really transmitting much? We don't know the answer to that. And the real way of determining background infection rate would be an antibody survey to pick up those who've been infected and have recovered. The problem with that is that we have perfectly good antibody tests, which we can use on, say, serum drawn from someone's arm or taken from a blood bank. We don't have a spot test where you can use just a finger pinprick of blood that provides a really satisfactory antibody test. We do think that there is such a test coming online pretty soon, and it may come out of Singapore. And that would be great because we need that information. Once we can determine background infection rates, we can work out what the true mortality rate is. Many of us have suspected it may be somewhere around 1 to 1.6% of those infected, but really we don't absolutely know. And a lot of the data, I mean, if you look at the data on the websites for the number of people who've been infected worldwide and the number of people who died, or the same information from the United States, the mortality rates are much, much higher than that.
Thank you. The question on immunity to COVID-19, and that's a very complex topic, but some of our listeners are asking, how does one develop immunity to this particular virus?
From the limited information we have so far, we've looked at it in a lot of detail, which we have the capacity to do in our institute. We did some some terrific collaborative studies, for instance, with Fudan University some years back on the H7N9 influenza problem, where the virus was going from chickens to people, but not spreading between people. We set up, my colleague Catherine Gizierska set up a wonderful system for looking in great detail at the immune response at that time. And she's now applying it to COVID-19. It looks, from what we've seen so far, and we've only sampled people which are relatively not particularly sick, as I understand it. It looks as though it's a pretty standard immune response. I mean, it doesn't look anything remarkable about it in those cases. And it looks as though they will make a good antibodies response and they will be protected, at least for a year or two. We don't know anything about long-term protection, obviously, because the virus hasn't been around for long enough. On the other hand, we are getting this late onset disease, which mimics elements of what the clinicians call acute respiratory distress syndrome, which occurs in various situations. Also mimics aspects of what you see in very, very severe influenza. But there are other things there that are quite unusual. For instance, a lot of clotting going on, blood clotting, a lot of oxygen deficit that's unusual. And I thought initially that it was like flu, that people were actually drowning in their own lung fluids, but I think that's not clear. I think that may not be the case. So there's an oxygen issue there, and so it's a different disease. It's a very different disease from flu, though it can look similar in some clinical respects. So that end stage disease, we think we may have a cytokine storm effect there, and there are some of the treatments that have been done so far because they might indicate that's the case, but a lot of the treatments haven't yet been properly trialed, and it's very easy to come to the wrong conclusions about something until you've done a proper trial, which is why this is essential. They're being rushed through.
Thank you, Peter. Question from our chairman, Doug Ferguson, on Indonesia. What's your assessment of the situation there? And do you think Australia should be doing more to assist its neighbors in the region, in the Pacific and in Southeast Asia, to handle this crisis?
We have been reaching out, just as other countries have. We have, I think, provided advice to Indonesia. I'm not sure whether we provided training to the Indonesians. I think Indonesia may have a much more severe problem than we're currently seeing reported, but I don't know of any details of that. We worry about this right through what we would the more developing world, if you like. There's a lot more going on than we're actually seeing reported, but we don't know. At the moment, for instance, South Africa, it looks as though it's done really well. We also wonder whether there might be other effects out there in some countries, such as microbiome effects and so forth, that are making the disease less severe in some countries where people are regularly exposed to a lot more background infection. That would be fascinating, and of course great if it's true, because we don't want to see enormous numbers of deaths in the poorer countries. We have been reaching out a lot, I know, in the Asia-Pacific region, helping people get testing. That's been backed by our government, and it's also been done through WHO Influenza Collaborating Centre, which has regular training programs running in Pacific countries. So we're doing what we can to help. And I think Australia in general does a really good job in helping our Asia-Pacific neighbours when there's crisis situations. In fact, our Navy seems to be designed mainly to do that, to deliver stuff.
Thank you, Peter. And follow-up questions on that, on Africa and the Middle East. We haven't seen much reporting or through mainstream media on what's going on in Africa. You mentioned South Africa just now.
Yeah.
For countries that have fairly weak and underfunded health system, obviously this presents an enormous challenge. What are some of the responses that they can use to fight this pandemic?
Well, I mean, of course, that we all have the social distancing possibility, but depending on whether you're talking about African cities and camps, which can be hideously overcrowded, of course, as with the Indian situation and the favelas and all the rest of it, we really fear for those people. Social distancing in more rural communities can work better as long as you stop people coming in. I think some of the, certainly South Africa has been very proactive in trying to put some of that in place, and people have been very cooperative, as I understand it. But I don't know in detail about what's happening there, and we may not know until this is over, or we may never know. You know, we don't really know how many people died of influenza in 1918, 19. Particularly, we don't know what happened in those poorer countries, which were mainly then under colonial administrations.
Going back to the science and public health questions, one of our listeners interested to know how can bats be the carrier of so many deadly viruses like the coronavirus, yet themselves never get sick from it. Only once in humans does coronavirus pose a threat. What's your explanation of that?
Yes, it is fascinating, and many of us have been wondering that. And only since this happened, we've become aware of very interesting research that's been going on in Singapore and also in China, I think, which suggests that the bat is controlling infections in a way that's different from us. We have two basic arms to our immune system. One is called the innate system, which goes right through evolution. And we share elements of our innate immune system with fruit fly and all sorts of things. And in fact, there have been Nobel Prizes for studying innate immunity in fruit fly. But then we have the adaptive immune system, which is the highly specific immune system that we stimulate with immunization or with infection, and is only in the higher vertebrates. It's only in the bony vertebrates. So it comes in about the bony fishes. So it's young. It's only about 350 million years old. And that we have through the vertebrates, slightly different themes in birds and amphibians and in us, but achieves much the same thing in all those species. We think the bat, even though it's a vertebrate and it's a mammal, that the bat may be putting more emphasis on controlling viruses through its innate immune response rather than its adaptive response. And we think what may be happening there is by damping down the infection with various innate immune mediators, we call them molecules, chemicals, it's keeping the virus in check and allowing it to persist much more than it would in our situation. When the adaptive immune system cuts in us, we will normally eliminate a pathogen, influenza, COVID-19. We just get rid of it within a month or so at the most, usually. And that's it. But along the way of getting rid of it, we can trigger some mechanisms, partly which come from innate immunity, like cytokine storms, which can be lethal for us. Because in trying to get rid of the pathogen, they may cause a lot of vascular leakage and so forth, and get rid of us. And that's maybe part of the late problem with COVID-19. So we think the bat may be handling these things differently, and which makes it pretty fascinating. And it means it's going to be a substantial concern for us. It's not just the coronavirus. There's also some para-influenza, paramyxo type viruses that seem to be persisting in bats, Hendra virus, Nipah virus, and of course we've known for a long time Lissa virus, the rabies type viruses. So bats are a risk, and we need to keep bats and humans and species that will transmit to humans after being infected by bats. We need to keep them apart as much as we can.
And this leads me to the next question about wet markets. There's been a lot of attention, obviously, on the origins of the virus and where it occurred in China. What's your take on the calls from some of the politicians to ban the wet markets, or for China to do something to address this issue? How important is it?
From my perspective as a scientist, strictly as a scientist, is the sooner these things are gone, the better. But of course, there are big cultural and social issues here. And for us to dictate those to China, I think, firstly, it would be pointless because people don't dictate to China any more than we dictate to Japan about whaling. So I think hopefully they will work this through and come up with compromises that keep us all a lot safer than has been the case. The wet markets are also, it's not just to do with food, they're also to do with various traditional medicines and so forth. And as you know, once you get into those cultural type practices and criticizing cultural practices in other countries, you dig a very rapid and rather large hole for yourself. So I'll avoid that.
Thank you, Peter. And the question from our audience about the personal protective equipment and the shortages that the COVID-19 has exposed around the world. Do you have any suggestions of how sort of the sharing of the personal protective equipment and the supply chains around it can be better organized post the pandemic?
I think it's up to, we're still organized around nation states. I think it's up to nation states to make sure they have adequate resources in hand. I think all of us now need to think in terms of not just in time delivery, which has been more and more the case, but to think in terms of having actual a supply in hand under the control of the national government. So it can't just be sent out, because some of that happened at the beginning of this outbreak. So I think that's one of the things that needs to be a lot of rethinking. I think globalization, personally, there are areas there which are kind of problematic. I mean, we don't, for instance, put a carbon cost on globalization. And I think globalization of trade without some globalization of governance, I would like to see that change, but I don't see how it will change. And I'm neither a politician nor an economist, so I don't see anything I say having much resonance. But I think Australia particularly, I hope we'll think a lot more about returning some of our production capacity, which we've pretty much abandoned for cheap goods in low-cost labour countries where there's exploited labour forces. I think it's kind of disgraceful, but that's the way it is.
Mm. The next question is on, I guess, human mobility and travel. Obviously, a lot of the export industries in Australia have been dependent on a free flow of goods and people, particularly international education industry. We welcome many hundreds of thousands international students in our universities. Obviously, that's been affected pretty badly, as well as tourism. Do you see a quick resumption of international travel and student mobility later this year and early next year?
Honestly, I'm not really well equipped to comment on it. I hope we still continue to get substantial numbers of students from Asia. I think it's enormously broadening for us, and it's broadening for them as well, and it builds bridges. I don't think China bashing helps that, and I wish we would stop that. But I don't know what's going to happen in the long term here. Australia, if we keep the virus damped down, we're certainly going to have to keep incoming international travel damped down until we can be assured that people coming in internationally have been vaccinated and have good antibody levels, for instance. So there's going to be a limitation on travel, until such time as we have a decent vaccine out there or decent therapeutic drugs. So I don't see that changing too fast. Personally, I live in central Melbourne. It's great to see a big mix of students of all backgrounds. And I think in the past, we've done this for a long time. They're not at the level we're doing it now. We've had some very, very good friends in places like Hong Kong and other Asian capitals who've done their university training in Australia and then have gone back. And I think it's a way of promoting international amity. And I think the more we do of that, the better.
Thank you. Now we're almost out of time. Last question. While researching for this interview, I looked at your Twitter feed. There's a lot of good stuff there. One thing was terribly useful, the responses to your tweet on the opening hours of Dan Murphy. And for our listeners, Dan Murphy is our major alcohol retailer. Do you know what time it closes on Mondays?
It normally closes at 9, I think. What happened was I was working simultaneously. I've been flat out. I've been working harder since COVID-19 than I have for some time. I was just writing a book before that and preparing to retire finally at age 79. Now I'm sort of working full-time, trying to do communications for our institute and take the pressure off the people who are actually doing the work, because I'm no longer running research programs or a research lab. So that's been very busy, and I'm not as smart as I used to be. And I was working on Microsoft Outlook, and I had the Twitter open, and I mistakenly put a question about the opening hours for Dan Murphy into Twitter instead of into Google. And so I got some very amused responses very quickly. My wife told me quickly what I'd done and how stupid I was, which she does regularly. and as wives do, and they should. And so I immediately tried to defuse it by joking around it, and we had quite a bit of fun with it actually. And then by the end of the day, though, I now have 8,000 more Twitter followers. So whatever that means, I have no idea. But on Twitter, I when I'm speaking on something like this, I'm kind of restricting myself to remarks. Well, I suppose to some extent, not totally, to remarks that I make openly in the context of the Institute. On Twitter, I basically think I'm an individual and I have the right to say what I want. And I have, among other things, an absolute right to make a total fool of myself, which I can't do regularly. We all do. I mean, I think if human beings get it 60% right, we're doing really well, which of course President Trump doesn't believe. He has to get it right all the time. But quite frankly, I think that's a ridiculous position.
Well, Peter, thank you very much for joining us today. We're all much more hopeful about the future, knowing we have people like yourself amongst us. Let me go back to Asia Society Hong Kong and our Executive Director, Alice Mong, to officially conclude the program. Thank you and have a great day ahead.
No, thanks, Philip, and you.
Thank you. Thank you both. Thank you, Peter, and thank you, Philip, for a wonderful discussion. I, as always, learned so much from programs like this. And this is one of the reasons we started it. It's just kind of, I think what Professor Doherty has been able to do is really lay, in layman's term, help us understand the complexity of the issue and how important it is for the global community for us to all work on this together, on solving this crisis together. One of the things I take away is the importance of the people, the government, the science community, and the foundation, the philanthropy. It's all to me, it's kind of like a four-leg table, not just a three-leg soup, a four-leg table. Each is important. So thank you both for that really wonderful discussion. And I also wanted to kind of mention in our previous discussion with Professor Borzone from Hong Kong New Pasteur Institute poll last week, remind people that Hong Kong's role, it's been 100 years of research in infectious diseases, is not just through COVID-19 or SARS, but it goes back as far as 1894 when Alexander Yeltsin discovered the plague here in Hong Kong. So the role of Hong Kong and a global city like Hong Kong in terms of the collaboration and the wonderful work at Hong Kong U, the CUHK, and we just heard recently the government is going to increase research funding for some of the institutes here in Hong Kong, and we're delighted to hear that. And in fact, it reminds me, it was exactly 5 years ago, we had the pleasure of welcoming Professor Doherty here in Hong Kong for our fourth Nobel Laureate Symposium on global sustainability, and gathering 10 Nobel laureates here at Asia Society Hong Kong to talk about the important issue of sustainability. And we look forward to welcoming Professor Doherty back, if not in person or by Zoom or by technology, to talk about his new book. We look forward to hearing more about that. And also, I wanted just to remind everyone, our episode 14, it's not yet on the Asia Society Hong Kong website, but it will be soon. We will have episode 14 on Monday, May 13th, conversation with Dr. Peter Forster, Fellow, McDonald Institute of Archaeological Research, University of Cambridge. And he's also the Director of Research at the Institute of Forensic Genetics, so joining us on May 13th. So please come back. And again, a lot of the information, this particular episode, as well as other Asia Society and Asia Society Policy Institute webcast, is on Asia Society website. So please join us in the future. And again, my gratitude to both Professor Doherty and Philip, and have a safe day and safe rest of the year. I know we're all in this together, and we look forward to future collaboration with either the Institute or Asia Society Australia, and look forward to welcoming you all back in future discussions. Thank you and have a good day.